We're going to just let people dial in for a few minutes, and then we'll make a start at 11:05 with our first speaker. Graham, have you got your washing out, or have you got it in? I know the weather's a bit up and down.
No washing out today, mate. It's grim up north.
We've got some esteemed names coming in now. Professor Pitt on, which is great.
Just to give you the heads up, we are expecting quite a few people in this session today. I think we had about 65 registrations.
Wow.
So it's going to be busy. You may need to gauge the Q&A time depending on how shy everybody's feeling. But yes, we are expecting a lot of people today.
Yeah, that's fantastic news. It's always important that I get more people onto the ones that I'm fronting than the ones that Paul fronts. And we might publish a graph perhaps just showing those 2 lines going through time. No, that's brilliant news. That's brilliant news.
Goal hanger fast. Goal hanger. Yeah, goal hanger.
So I agree, Amy. I think as the numbers get bigger, sometimes the interaction goes down a little bit. But what I've asked Ross to do, and we can kind of liaise on this, we have a very, very good active chat on these channels, which we can take away. For those coming on, please post links, please post questions. Paul, if you don't mind helping me kind of sift through some of those as we go, and we'll pick out some of the key ones. But we will, as we have done, we'll write up a blog of these sessions anyway. So if there's questions and comments and helpful links and things that people have put in, we be assured that we will write all of that up and publish it on our website as soon as we can with our interpretation of the session, links to the 3 presentations, but a whole blog that links away to, and here's an interesting link that Rony suggested while we were in a chat. So it will all be there and none of it will be lost. So it's fantastic that we're getting so many people coming in. I'll give it till, I'll give it a minute. And I think we'll start actually. I think we're okay to start just because I'd rather people listen to our 3 brilliant speakers than me. We've been running these sessions since the beginning of COVID. This was a fantastic idea that Paul had as kind of COVID launched, and we had met about 18 months or so ago when I spoke with the topic of data saves lives at a Open Data Institute in Leeds event, and we got quite a bit of interest, and we thought there must be some way of formalising this. COVID came along, these sessions came out, which was a sort of embryonic idea out of LDR Leeds, and they've kind of run and run. So the Open Data Saves Lives initiative has been put together with ODI Leeds and Beautiful Information. We are in the process through this quarter, January, February, March, of formalising it in more detail. We've got a website, a business plan. We're talking to potential sponsors. Some have confirmed, some we are currently talking to, which is all very exciting. And we're just really grateful that this community is kind of building. We've already published some quite powerful research, we think. We've done a great piece on domestic abuse, for example, linking police data and emergency department data. We've done some great stuff on geographies, which might sound boring, but it's so important. We were sat at the beginning of COVID not knowing where care homes were in the country. And I'm already involved in a sort of digital care home program now where we're potentially linking up care home data, looking at better outcomes for care home patients, something that just hasn't been done before. No one's looked at the digital maturity of care homes, for example. We've encouraged, and I got into a bit of trouble about this on Twitter as Paul did, we've encouraged the NHS and Public Health England to work together better on sharing data, and exemplified by Boris getting a direct question about that last night, which I think is really good. So this is a mission to encourage brave use of data for public good. And I thought I was going to call him Jean-Claude Van Damme. I think his name's Jonathan Van Tam. Gave a really useful explanation last night of how it's very, very important to get the analyst in the room and ask a very clear question. So, are children at risk of COVID? Yes, but the numbers are tiny. Does it increase as you get older? A little. Are teachers at risk of COVID? Not at any level higher than any other occupational group. And he laid out for an analyst, I thought, a really, really clear way of addressing an issue. So people like myself and Fraser and Rony and Ellen and Martin are very interested in how people ask a good research question to an analyst, because it is not done well, to the point where we're almost designing a Haynes manual, if those old enough to remember what those are. So I thought the way that JVT, as Boris calls him, set that out was quite powerful. It was a really interesting narrative, the way he set that out, with here is a fact, yes, here is another fact, no, and so on. Really interesting. I work in a big hospital. We have had challenges with local news. In the spirit of open data saves lives, let's name everyone. So there's a website called Kent Live. I'd never heard of it. They published a story with some national data, which then somehow garbled into some mortality rates. It was nonsense, but it sort of didn't matter to them because it was clickbait through Facebook to get ad revenue. And I think what's really important through this time is that you get good analysts that, you know, Rony's trying to create a community around, who actually understand the difference between crude data and adjusted data. And I'm not surprised that larger trusts have higher numbers of COVID deaths than smaller trusts. So when you do a nice simple Spearman's rank coefficient around that, and you show that there's a very, very clear correlation between the size of an NHS trust and the number of COVID deaths in it, most trusts are kind of where you'd expect them, but these are not reported by local news sites. And I think we as a community have to kind of challenge that. So I want to get straight into it. So we've got three fantastic speakers. The session today is all around the role of the analyst during COVID, which is, we've been an analyst community for a while now, formally, through Rony's group for 10 years or so, but COVID has really brought us out into the light even more. So with no further ado, I'm going to hand over to Rony. You've got about 15 minutes or so, Rony, and then I'll come to Ellen from the Health Foundation. So share your screen and the floor's yours.
Thanks, Mark. Thanks for the opportunity to come and talk to you. Let me try and share this screen. We tried it before, so hopefully it will work. Is it working? A thumbs up would be good. Can you see my screen? Great. Thank you. So I'll start. So I'm Rony Arafin. So I'm the Chief Operating Officer of AphA, and also I'm the Assistant Director of Information for the Devon STPs. I've been working in NHS for a while. So from both of those roles, really passionate and keen about analytical community, as Mark said. So a little bit about AphA, if I can go next. Okay, so we've started we've been there since 2012. So it started really in the Southwest region. And if you can see my screen, that we've been evolved over the number of years, and Mark's been a great collaborative member of AphA for a long period of time. And a lot of you who are in the call, actually, Ellen from Health Foundation, we have a lot of support from Ellen, the strategy unit. We work with a lot of people. So I've been involved with AphA in my professional capacity since 2014, actually, when the committee was established, and we went on to become a CIC in 2016. And the last August, actually, I picked up the chief officer role for AphA. And since then, we've introduced a new board. So I wanted to give you a little bit of background around AphA, and then I will go in to talk to you more about the analyst and the impact of COVID. So we have lots of analytical leaders now in our board across England, and a set of non-executive members who brings in a lot of expertise and leadership around analytics. So this is really good for us to champion the profile of analytics across the UK. And we've set up, we had a meeting this week around an advisory committee. So the idea is there is lots and lots of good analytical work going on across the landscape. So we are very keen to bring people together. And again, a fantastic opportunity for me to come and talk to you. So thanks to Mark and Ross and others for inviting me to this. So we've kind of refreshed as an organization our purpose and what we are there for. So it's really to raise the profile and become the voice of health and social care analysts by providing professional registration. So we are the only analytical professional body that's accrediting analysts from all levels, their professional accreditation, and developing that community of analysts across the UK. So we have branches, and I'm going through the slides quite fast, but I'm sure you can, the slides could be shared afterwards so you could have a look properly across the UK. So we're not just England based, we have members from Wales, Scotland and Northern Ireland, which is really good to share and learn from analysts all over the UK. So I've been asked this question quite a lot, and I have had a lot of reflection myself around, why we should consider AphA. So as an organization, we've set ourselves a lot of targets which are really quite clear in our mind, that we will help and support the analytical community to develop the analytical capability through really, in my mind, a lot of signposting. As I said, there's lots of good works going on, and really provide that professional recognition, accreditation, so you could really receive that recognition. Obviously, to become a really good analytical community to share and learn work. But also, I think it's very, very important to represent this community as a scientific profession, because we have long sat in under admin and clerical profession, and something I'm sure Mark's also been involved in many discussions previously. So it's really a thought-provoking question. So why professional registration for analysts? I suppose I'll just leave you with the questions that would you drive a car if you didn't have a driving license? Or even, would you get on an aeroplane knowing that the person who's flying the aircraft is not got the aircraft license? So why is it any different than when we're using data to help people's lives? So there are lots of benefits becoming an AphA member. I'm happy to share with you, or you could go on our website and look at that. But really, to very quickly say to you, we are giving professional registration. We have a monthly magazine that's getting stronger and stronger every month with lots of analytical content. And really, for me, I think the biggest advantage of having the analytical community to share and learn from each other. Membership is very low cost. It's less than a croissant and a coffee every month. So it's not, too much to spend, particularly if we are really passionate and keen about analytics. So some of the work at the moment, AphA as an organization is looking at, is working with NHS X, NHS Health Education England and Health Foundation to look at how we could bring together some of the really, really good work that's going on out there, but bring together a consistent analytical competency framework that shows a career journey for an analyst. That's been long thought about, but there isn't any single source that pulls together all the good things. So we are embarking on a discovery piece, and hopefully we'll carry on continuing to host that work. So I wanted to talk a little bit about the impact. So from my obviously day-to-day role, AphA, and my NHS role, I mean, analysts are busy as it is. Our teams are faced with lots of various demands. And then obviously an unwanted visitor popped up last year, and the rest is history. We know how that impacted our lives, and it's still continuing to impact our lives. But I think through all those challenges, doing more and more daily sit reps, doing lateral flow testing, vaccination data return, you name it, we've got even more data returns that we're doing day by day. I suppose I wanted to focus on, if we could reflect a little bit of what are the opportunities for us as analyst group, even though, we can talk about for days around the challenges we have. So I think the opportunities opened up that, for me to be able to remotely, talking to you today and not travel to the place, it's just makes it that much easier to share and learn from lots of experts across the UK. So you can really start to take advantage of some of the learning. And when I say that is that analysts in some ways, because of lots of various different factors, sometimes are very closed in terms of the scripts that we're doing, the code that we're doing, we're not able to share it. And what Mark kind of described, that I'm really keen that AphA stands 100% behind this, is just we need to be able to support each other. Why write a code or a good analytical methods when you have it already and somebody else from other parts of the UK could make use of that? And it's all public money, right? We're working in the health and social care sector. We need to be able to be open to learn. And the last point is really, as an analyst community, I think we need to be more curious. We need to start asking questions and constructive challenges when people are asking us for, just give us that data. We need to really understand that as you're asking a professional, please tell us, not by giving column A, B, and C, just tell us what you're trying to answer. And let me think about what is best for us as a professional to give you what will answer what you're looking for. So be curious. I think this is a very, very good thing. And this will make you start to enjoy your role a lot more rather than just transferring data from A to B. I think none of us has started the profession for data moving, for example. We all want to be an analyst. And I think there's some fundamental gaps around some of the organization about visible analytical leadership. So there needs to be some role model. When I talked about the career map, people from universities, apprentices coming into analysts as a career path, they need to look up to where they could look up to for a role model. So Mark, obviously, Mark is a role model. There are lots of people who joined this call today. They are very, very good analytical leaders people could look up to. But the point I'm trying to make as well, actually, on a side, that sometimes people get very, very confused about the term digital. And digital and IT somehow got the better of data and analytics. So people think that it could be covered. And for a long period of time, we've seen people talk about software, people talk about EPR system, people talk about other software development. But that isn't data and analytics. Data analytics needs to have its own entity, a visible entity, to really drive some of those things that I have talked about in my previous slides. So I'm not going to take much more time, but really a plea, because there are a lot of you are interested in data analytics. We will hugely benefit your involvement to join our community and really enable us to drive forward some of those conversations about the voice of analytics, why analysis is important, and also why should we go public and share our codes and methods about the usage of data to help somebody else down the road, to help somebody get better through the use of good analytics. And that's what the biggest learning from this whole COVID situation, that we could really materialize. And that's it. So please do visit our website and do contact me, do contact others in AphA, and please get involved, come and talk to us so we could really voice the analytics as a recognized profession. Thank you very much. I'm happy to take any questions.
That's brilliant, Ronnie. And we've got a couple of minutes. I'm going to try and get Ellen on before 11:25. But I'll start with a question from Ellen. Ellen, do you want to ask your spreadsheet question?
Yeah, so actually this is often quoted by, I most hear it from Paul Stroner, but it's like a familiar refrain of his. He says you can do more damage as an unskilled person with a spreadsheet than you can as an unskilled person with a scalpel. So I wondered if that kind of rang true for you.
Absolutely, you would know, Alan, it's a really, really good question. So Excel has its place, right? So I think lots of tools has their own place. I think sometimes we think too much around the tools that we use, but I think it's more, we need to put more on, what kind of analytical methods and practices that we're using, what questions we're trying to answer. These are all the tools that you have in a tool belt, essentially, isn't it? But just to point out, the government obviously made a big mess. This is probably not politically astute, but made a mess about reporting some of the COVID numbers. And from an AphA perspective, we wrote to Matt Hancock, Simon Stevens, and Ellen and Mark's been part of writing that letter to really lobby around asking for an independent review. So we will continue to do those things when government makes mistakes and they come up with policies that is not fit for analytics.
Yeah, just a comment, which I think you might take as a question, Ronnie, from me. And I've asked in the chat about how we distinguish ourselves from the IT crowd. And my reflection, I agree with you, my reflection over the last 10 years is that as chief information officers or CIOs have developed really, really well. There's a CIO network, there's digital academies and so on. And I think what they've done is they've become in charge of the big IT purchase. And thereby they've created a very powerful role, not maliciously, because they are IT experts, and you would want an IT expert to choose an EPR system. And for people who don't work in the NHS, these things run to tens of millions of pounds, and they are literally the electronic record of the patient. So they're a huge purchase with, often a 5 or 10 year lag to it. And I reflect, and I'd be interested in your opinion and others maybe outside of this, that in analytics, we haven't quite done that yet. So we are in a situation where there's a huge analytics market, but it's delivered by huge management consultancies, software companies, and so on. And people like you and I haven't got in the way of that purchase decision to make it better yet. I'm trying, and I'm making some progress, but there are still great big management consultancies and software companies around that go and sell to a chief exec or a regional accountable officer way above my head. And I just reflect on that. And if you want to come back on that, I'd be interested in your initial thoughts.
No, absolutely, Mark. And I feel exactly the same. And that's why I was quite keen to put a slide around the visible analytical leadership. And what I mean by that is really we have to have influence in the board level, where it isn't delivered by, so somebody, a director of IT and CIOs, they could make decision about, spending multi-million pounds on an EPR. Similarly, as an analytical leaders and professional, we should be able to discuss and really assess whether, some commercial companies coming in and delivering some analytical piece of work for £2 million, for example. So Fraser, obviously strategy, and we've been discussing this with Peter Spilsbury. So that's a bit bugbear, that people come into an NHS organization, essentially actually use the expertise of the analyst within the organization in health and social care, and then create 2 or 3 slides without really sharing the code, without sharing any of the methods, and then they go away. But I actually agree with you, Mark, and I think this really warrants some exploration time, that how the CIOs and CCIOs, they have put together their network. There is something for us to actually learn from that and develop similar presence.
Yeah, no, I agree. And I think to your first point, I think that's exactly what we're going to try and do with Open Data Saves Lives, which is make the case and be very, very aggressive about there's no such thing as IP in a demand and capacity model. Just put it out there, share it. You learn from mine, Rony, I'll learn from yours, and so on. Okay, fantastic presentation. Thanks for coming along. Ellen, from the Health Foundation, brilliant to have you too. Floor's yours.
Thanks. Let me share the right screen first of all. So hopefully you should be able to see that. So good morning, everyone. Thanks for having me speak on the community of practice, or building a community of practice. My name is Ellen and I work at the Health Foundation. I manage a programme that seeks to advance the use of data analytics in health and care across the UK. It's a rather broad ask, so we do it in a number of ways. So I fund teams in the health and care system to test innovative analyses and develop new tools. I support kind of models of collaboration like the Association of Professional Healthcare Analysts, and we also kind of do some promoting of actually like the investment of in analytics, that sort of top-down aspect. And I think in the time that I've been in this role, I've seen a huge amount of work really done to kind of lay the foundations of analytical capability that will enable teams and communities to kind of accelerate positive change and innovate in the field of data analytics in the health and care system. And so I'm starting with this sentence, which I think kind of optimistically sets out the crux of the opportunity. What we're all trying to do is to safely harness the power of data. Our ambition, kind of, long term, is to improve health and provide better care. But actually, what we're trying to do, in the here and now, quite urgently, is protect everyone from the pandemic. But between kind of us and this healthcare nirvana sits a number of challenges. So I'm going to set out what I think these challenges are and how communities of practice can help us address them. As the famous poem goes, no analyst is an island. So we have kind of seemingly endless amounts of data at our fingertips and within our clinical systems. There's that much cited statistic that the NHS sees something like 1 million patients every 36 hours. And that doesn't even begin to touch the people that are being kind of cared for and seen through social care. So essentially day in, day out, we're amassing a colossal amount of data. And I think the challenge is kind of in effectively recording, safely storing, ethically accessing and sharing, analysing and presenting that data in a way that produces actionable insights that can help us kind of improve the way in which care is delivered. And in a time where, according to the Marmot 10 Years On report, which was published last year alongside the Health Foundation, you know, we're looking at health inequalities widen, we're looking at life expectancy stalling for some groups, particularly women in the lowest poverty, well, in the lowest deprived kind of areas, and resources becoming scarce. So kind of against this backdrop, it's more important than ever to make sure that data is brought to bear on these problems. It's going to get more cheerful, I promise. So the challenges of harnessing, you know, this data, access to quality data in a timely fashion, enough analysts with the right skills, effective communication between analysts and decision makers, and we've kind of touched on that already this morning, access to the right tools, engaging with patients and the public to ensure that data reflects lived experience, and kind of making sure that there's analytical literacy at kind of all levels of seniority. So these issues span themes of supply, they span themes of demand, inclusion, deciding what data is valuable, and also deciding kind of whose voices are worth listening to. So what I'm going to do is just kind of talk about how communities of practice can play a role in addressing the challenges I just set out. I'll begin by kind of introducing the concept of a community of practice. It was introduced in the late 90s by Lave and Wenger, and they were kind of really just describing an age-old concept. So the groups of people that share a passion or a concern engage in a process of collective learning. So they can take many forms, but they're generally defined by a particular domain of interest, joint activity and relationships, and a shared kind of repertoire of resources like experiences or stories or tools. They can be formal, like the example that I'll explain in a moment, or informal, like a group of clinicians, for example, meeting for a lunch, you know, discussing patient care. I guess maybe kind of like a semi-formal one would be, we talk about like, I don't know, medicine Twitter or something. Is that community of practice? Probably. They can kind of take all forms. So I've tried to illustrate on this slide what some of the functions and benefits of communities of practice. And so kind of bringing together individuals and organizations from various disciplines and areas of expertise, or, you know, bringing in people that have lived experience, helps promote a culture that kind of every voice and experience is valued, so long as the community is actually organized in, you know, an egalitarian way. Developing trust and relationships between organizations is a natural precursor, I think, to attitudes of openness and transparency. So that lays the foundations for better sharing and open practices. Being able to share methodologies, being able to share works in progress, you know, best practice, these all go some way to solving those issues that I described of kind of skills deficits, because people are able to learn from each other and, you know, adopt each other's processes rather than duplicating work. And kind of thinking more forward-facing, perhaps kind of developing new blueprints for working together, and that kind of collaborative problem solving brings analysts and decision makers into the discussion from the beginning, which is really important, because being able to talk through what good looks like, kind of, it sets a language for the way that decision makers ask questions of analysts, and in turn kind of how analysts answer those questions. And that comes back to something that Mark mentioned earlier, which is how do we become better consumers of data? How do we become better users of data? And I think that sort of setting of the language is really, really important. So I'm going to just describe a community of practice that we at the Health Foundation in my program have established. So as I've put on this slide, you know, the pandemic has really revealed and exacerbated major structural and cultural weaknesses in the social care data system. These problems have made it harder for the country to respond to outbreaks and to support carers to provide care during the pandemic. And ultimately, all of this has led to avoidable suffering for the most vulnerable people in our society. And the thing about social care is that it extends into this kind of complicated, intimate arena of daily life. It doesn't just include supporting people's health, it includes the management of their house, you know, their social lives, their working lives, their support networks. So delivering those services requires a really a huge amount of information, but also a really wide range of information. It requires operational data to manage, large and varied workforces that have to travel between locations to deliver different services on a really strict schedule. And on top of that operational data, it needs administrative data to support it. So managing payments, meeting regulatory requirements. And it also requires information about well-being. And by that, I mean, it needs data on how people want to live and what matters to them. And crucially, we had in May last year, May, June, we brought together lots and lots of different people who have an interest in social care. And those accessing social care and their carers said that they didn't think that the system consistently fulfilled that final requirement. They reported feeling kind of disempowered, tired of not being able to access data that's recorded about themselves, feeling dismissed. And actually, those issues are bound up with wider structural issues like ageism, ableism, and kind of the undervaluing of care, really wherever it happens throughout society. And I'm not going to pretend that I can solve those problems today, but that social care data system really poses a number of technical and cultural challenges that need to be solved collaboratively now, very urgently. So we established a community of practice to provide a space to discuss those challenges, to kind of develop norms and facilitate relationships, to build trust, and to promote exchanges of ideas and methodologies. And so the community practice will, in this particular field that, as I said, requires kind of thoughtful but urgent action, it will contribute to kind of addressing those issues. So, for example, it will hopefully promote integration of systems and bridging of silos with hopes to kind of make data that already exists useful and accessible, and start bringing together ideas about how we can begin to record data that reflects the kind of gaps, like what actually matters to people. It's going to provide a space for teams of analysts to share their ideas and their progress so that they can learn from one another and equip each other with skills and tools. And that particular bit kind of corresponds with the funding program that we're running alongside the community of practice. So we have 5 projects that are going to be sharing their code, methods, tools, so that everyone else can learn from what they're doing. We'll kind of set that language that decision makers and analysts need to kind of communicate effectively, and will help decision makers to really understand the value of analytics, something that perhaps a year ago was something that we were really pushing against a closed door to try and get that investment and that top-down value. We're trying to persuade people. Obviously now, over the last year, everyone understands the value of analytics. I've been having conversations with friends who know nothing about analysis, about like missing data or like the right tools to do analysis with, which is absolutely bananas, but there we are. And then it will also provide a space for people that need and access care to contribute their experiences and reflect their sort of lived experience. And it means that they're included in spaces that maybe they're not usually included in. So I guess what I would say is, if you'd like to be part of the community, just let me know, or just search Future Care Capital Community of Practice. We're working with Future Care Capital on it, and so they're running it. It's open to everyone to join. If you're kind of interested in any of this, you're like allowed and welcomed. But I do admit you do need to register with an email. So I know that Mark and Paul would probably challenge us to kind of open it up further. So I will end on this final slide, which should kind of challenge us and motivate us all to consider how we could be working more openly. I think what it means to kind of work openly within a community of practice is as much to do as being open about sharing information and ideas and being able to invite people into the space, as much as it is about kind of creating data and standards that are open and that promote kind of transparency and collaborative work. So thanks everyone for listening. I hope you found it interesting, and I'm more than happy to answer any questions that people have.
Thanks, Ellen. That's fantastic. I was going to make a comment, but I think you kind of summed it up for me. And I think what people often mix up is open data and open innovation, and it's something that Paul's kind of coached me on over the last year or so. And there's been open source and open data for 30 odd years, but there hasn't been this type of thing where we're starting to challenge people who hide code and who perceive themselves to have created IPR and so on. So I just reiterate your last comment about open data is kind of, that's almost a given. I think it's more the open innovation bit, which is how you create this strong collaboration between people on this group. And a lot of what's come through on the chat is about the network and the relationships between Fraser, you, Martin, me, Paul, Rony, and so on. And one of the questions from Fraser is about how we, and James Jarvis, is about how we sort of promote and identify individuals. And I think you would say you're doing some work on that. And I'm very supportive of that because I think it's helped me. It's quite risky often what we're doing. And I wondered if you had a comment on that. So I feel like I'm often in a situation which I feel some risk in. You know, when I worked at Dr. Foster with some ex-colleagues who are on this call 10 years ago, I got sacked 7 times. I haven't managed to get sacked yet in the NHS, but I have been to bed a couple of times thinking that was career limiting. And I think there is a role for the Health Foundation because of the power that it sort of brings to create some fire cover. And I just wonder what your views are on how you might do that. Not people behaving flippantly, but people being bold. You know, the work that Fraser's doing, challenging Big Four consultancies, for example, and, you know, myself and Paul trying to put data out there. I think, how can we do more of that, I suppose?
So I think you're right, the Health Foundation has kind of a gravitas and very rightly like a really strong kind of weight that we bring to things. And I think the way that we can kind of capitalize on that is the fact that we have this independence. You know, we're not kind of, you know, although we work with so many different organizations, that's one of the benefits is that we kind of don't really have to answer to anyone except our board. So in that respect, we are able to kind of take bold steps. And I think what we like to do is to support our, you know, project leads or kind of partners in different ways. So it could be that someone comes to us with a great idea and we'll kind of either support it or fund it. And there are kind of different ways in which we can do that according to kind of like how we want to approach something. So we can definitely partner on a very kind of side-by-side working together basis, or, you know, kind of give someone the money and see if it works. And if it doesn't, then, you know, we give the people the freedom to play. I think that we do well with doing that sort of stuff. So it is really, really great that we have that independence.
Yeah.
But ask the questions that you can't ask or that other people can't ask.
That's really helpful. Thank you. I'm going to just roll this on. There's a good question from Joss in the chat, which I was going to ask, but if you don't mind answering that in the chat, Ellen, and then we'll grab that in the write-up as well, so I can keep us to time. So I wanted to get Fraser on before 11:40. That gets us through to about 11:55 or so. A couple of words from Paul and I, and we'll try and give you a couple of minutes back. So Fraser, brilliant to have you on. Fraser talks brilliantly about this revolution, and we joke we must one day do a picture of us all kind of looking at the sun, kind of like a sort of Chinese communist poster with one with a spreadsheet, one with a laptop, one with a scythe, one with a machine gun. So there you go for an intro, Fraser. Over to you.
Thank you. That's how I like to. You can see my slides. Can you? That's all working.
Got it. All good. All good.
Grand. Listen, thank you ever so much for inviting me. It's brilliant to get the invite to come and speak to you, and also brilliant to be alongside AphA and Health Foundation. Every time I've dipped into this world, I've got this feeling of a sort of head of steam building up and a clarity of agenda building, which I'll return to. But it's just brilliant to hear Ellen and Rony speak. I'm from the strategy unit. For those of you that don't know us, we're a team of, we're more than 40 now. We're growing fairly rapidly. We're an NHS team. We're based in the Midlands and Lancashire CSU, but we're a freestanding organisation. We have to earn our own money. We have to recoup money through project funding. And we're best known really for the quality of our analytical work. And there's a colleague, Justine Wiltshire, on the call who illustrates exactly what I'm talking about when I say that. But increasingly, we're interested in the application of the analytical work. So, and that's sort of where I come in, because I'm not an analyst. I'm an interloper in this world. But I am obsessed with decision-making, decision quality, with leadership, and with helping to make the case for the better use of analysis and to bang the drum and to try to lead things like the revolution. I'm going to talk about 3 things really. This is sort of frighteningly broad brush because I don't have very long. It's incredibly partial, as everything I say is. And I'm going to look at 3 things. The first, I'll say a little bit about what we were doing before the pandemic, the stuff we were into. I'll say a wee bit about life under the pandemic and just reflections on it. I mean, obviously it's not ended, is it? This is contemporary stuff. But I'll also at the end dust off the crystal ball a wee bit and say what I think the opportunities for the future might be. All whistle-stop stuff, so I'll raise more questions than I give answers. So pre-pandemic, the stuff that the strategy unit was into, the agenda we were developing, we are primarily about getting analytical talent focused on questions that matter. Decent strategic questions, things that might affect services, things that might improve outcomes, and off the sort of performance management focus that a large chunk of NHS analytical talent is focused on. All about decision making, and that was a margin we identified and we're really starting to press on, and particularly interested in engaging leaders in the better use of analysis. All about networking, sharing. I think this was something we were really trying to expand out on, you know, looking at analysts as a community of technical folk in the way that Ellen was talking about, and more about sharing code, more about open data, sharing assumptions, methods, and so forth. This was stuff that we were increasingly getting fired up by. We were getting all sorts of momentum into this, all sorts of capacity into it, and we were trying to exemplify it as best we could. I mean, there's a way of making the agenda that we have negatively. So I could spend a good ton of my life, you know, throwing bricks at the Big Four because that would be fun. But we're trying to make the case positively and by example. So the stuff that we were doing in the Midlands Population Health Management Academy through the setting up of decision support units in the Midlands and the decision support centre in the Midlands, making the case positively and by example. So really broadly, that's what we were into pre-pandemic. And then COVID hit, and for us, the basic effect has been that of as an accelerant or a catalyst for a lot of that stuff. It's not knocked us off course at all, but it's just accelerated and amplified what we were into already. So what have we been doing during? Well, we've just felt this. It's been beautiful. It's been edifying to watch within the team, a group of people, NHS employees, dying to commit. Some of us feeling the urge to go off down to the local hospital and make tea for nurses, those of us who are analytically useless. But the analysts really fired up, really wanting to contribute and seeing the need for analysis in the response. Brilliant collaboration with colleagues at Health Foundation and the Field Trust and the King's Fund to help just some light coordination really, so we weren't all looking at the same questions, recognising that there's not an endless supply of analytical talent out there. We did work to sort of really quickly pull a group of analysts together, an informal network together in the Midlands, just to sort of share what was going on. We've launched the Decision Support Centre in the Midlands, and we also ran a festival, the Insight 2020 Festival, which was all about analysis and the application of analysis in decision making. We did a piece of work which Mark was instrumental in, really partly in just sort of putting us up to it as much as anything else, the Analyst Revolution, which is just another way of describing the value of analysts and analysis in the system and really trying to get some fire behind it. There's a ton of brilliant interviews on our website. And we adopted a set of ways of working, some of which I love and want to do more of, others of which I'm now a bit wary of. We were working, particularly during lockdown 1, at I think an unsustainably quick pace. People were really squeezing the pips. They were really going above and beyond. So we were doing things faster. We were also doing things much more in the open. Previously, our temptation was to get things sort of like precisely right and then issue things. We were issuing stuff kind of as we went, inviting people to help improve what we were doing. There's a ton of informal mentoring going on across the team. Some members of our team were, you know, called upon by people that they knew to just help with things, to refine methods, to point to data sources. It was brilliant to watch. And we were being much more multidisciplinary in the way that we were working. So a huge chunk of our team does evidence literature reviews. They were working much more with our modelling team. It was just brilliant. There was much more multidisciplinary collaboration going on. It's still going on, but I mean, that was sort of that was the sort of leading edge of the effect as far as we could see it. I just want to end up briefly by just sort of sketching out a few trends as I see them, by just sort of speculating very slightly as to what might happen in the future. Illustrated by, I think it was the Oracle of Delphi. Did she eat herbs and hallucinate or something? And I think she was outed as being insane in the end. So with that context in mind, the things I see, this is all taken from our website as well. I've got an increasing sense of agenda in this community. If I look at the things that AphA are talking about, listen to the things that Ellen was talking about, watch what the Health Foundation is doing, see what you guys are up to, I just have an increasing sense that different people, different institutions are coalescing around an agenda. And I've pointed out a couple of things where we've tried to articulate what we think it is. I do wonder, sorry for the way I've illustrated this, but I do wonder if the fact that the decision maker analyst relationship is so exposed, it's like it's on the telly, it's live at the moment, we're watching analytical expertise and decision makers next to one another. Are we going to come out of this with a much greater appreciation of where expertise belongs and of how it plays into the decision making process, and therefore of what we as a community can contribute to decision making? I hope so. And I also, this is proper crystal ball stuff, but I looked at the integrating care consultation paper that NHSEI put out in November and thought about what it might mean for analysts, what it might mean for this community. And I can see a ton in it, a ton of things to like, a load of great opportunities, you know, heaps of rocks on the road, that kind of thing. But there is something there that we can get hold of if we play it well. Anyway, that was all I got to say. Please, you know, connect with us and so forth. We're trying to build our Twitter presence, so please connect with us on Twitter. There's our, whatever it's called, account address there. But thank you very much. Cheers.
Thanks, Fraser. Fantastic, as always. What are the things that you would like to do that are just beyond the level of appetite for risk that you've got?
I don't know if it's beyond our level.
So if you
I was going to say, I don't know if it's beyond our level of appetite for risk, but it's not our tone. The temptation I described to spend time throwing bricks at the big four and at some really terrible, low grade, expensive analytical work we see out there, that is profoundly tempting. I'm like a moth to the flame with that stuff. But every time I have to just go, no, that's not the fun. There's too much of that. That's incurable. Make the agenda positive example, positive case, and just try to draw things out positively. So in my darker and more tempted moments, it's that.
I just lost your sound there. I don't know if that was you or me.
Sorry. I don't know how much you lost.
That's right.
Basically, you're saying I'd love to throw more bricks at McKinsey, but I think it's the wrong thing for us to do.
Yeah. It's interesting, isn't it? Because we're trying to challenge ourselves as an NHS as well with the centre.
Yeah, I agree with that. I'm not in saying this. I'm not saying everything I observe in the NHS is perfect either. Of course, it isn't. I love what Ellen and the Health Foundation have done in terms of also turning attention to social care. I guess I'm thinking, what's the stuff that we can do most positively and most obviously? And it's keep on doing good stuff, making the case, showing good examples, and getting stuff out there. It's trying to lead by example and as role models, making the case positively.
Yeah, fantastic. Thanks again, Fraser. Pleasure as always. Paul, if there's anything you want to come in on, I thought I just might mention at the end that we just to give an update on where we're up to. Do you want to go for it, Paul, and I'll chip in?
Yeah. Can people hear me? Yeah, you can hear me. Just a quick question. Mark's going to shout at me now, but I asked this question every time. What do people think about future NHS?
NHS Futures.
Oh, no, my email, it comes up as NHS Futures, right, NHS Futures. Have people fed back about whether it's any good or not? Because please, I think we should feed back to them about whether we think it's any good. And I now have 1,500 unread emails from them in my inbox that I've been volunteered to be a part of. And Ellen, just a question of why do we always have this expectation that we have to register or put an email address to be involved in stuff? What the reason I ask is that it appears that it's an institutional or organizational need that stops things being successful.
Yeah. So having anticipated that question when I was writing my slides, I was thinking I'm definitely caught up on this, and rightly so. I think it is like an institutional thing, but also when it comes down to something really boring, it's when we want to fund a project to understand kind of its success and metrics. We want to know who's engaging, what kind of profession are they in, what kind of experience do they have, and one of the easiest and kind of most straightforward ways to do that is to ask people to sign up and give us a bit of information about themselves. It's as boring and kind of and simple as that. So I think that's basically why we like to keep a track of what we're up to and who we're engaging with. Probably better ways to do that though.
That's a really good. Yeah. So we just built a whole load of privacy rights protective tracking for our website to measure how that goes. We also have our dashboard that we've measured how successful ODI Leads is. And I think we could share some of that it's all open. We can share that with the Health Foundation. And do you know what? We get much better analytics than an email address of that, because you collect data that answers a question. So but then the big success is you get more people involved. So the beauty of the web is that you can count stuff that that works. So that would be my last question. And Mark, to Fraser, I think there are I'm going to ask you to do a guest blog about that, but we should. The point about the content's really useful, but it's not on the web and it's not searchable, so you can't discover it. So it's okay by email, but the way the whole world uses the web is to use a search engine to find that stuff, and you can't find it on the web, and there is a gatekeeper. You have to be invited to join. So that we need to. One of my things I go is use the web as it was intended. So how do we stop these walled gardens being set up to do that? Because people, when you search for things when you need them, not when an email address, someone sends you an email about an engagement where you engage on their terms rather than when you need the thing that you're looking for. So yeah, the other part of it is that Open Data Saves Lives. We almost set it up. Last year we did 20 events. We had over nearly 100 speakers and 1,000 people engaged. Nice round numbers when you say them out loud, which came from just me and Mark saying, okay, we need to do something. This year we're going to be partnering with the Health Foundation, so they're going to be a third wheel to our wagon, and if the strategy unit wants to be the fourth one, or others want to be 5 or 6, people can join in with what we're doing and join in with the mission. So these events are going to be, as well as myself and Mark, there's going to be someone from the Health Foundation who's going to be chairing these, and we're going to be spreading the word about how we do this, and creating a community of interest around what we do. And then, cross fingers, we're going to turn this into something, and that has to have money and business and a business plan and people around it. So post-April, it's going to be a thing. So Mark, is there something you want to join in around that?
Yeah, just to say, please join in. So the Open Data Institute and Leeds are putting in some money, Beautiful Information putting in some money. We've had one of the large CSUs say that they are up for sponsoring us for a couple of years. We're talking to Ellen and colleagues at the Health Foundation. It's no secret that people like Fraser and others, we're very keen to develop some sort of model where we can collaborate, prove the ROI on that investment. So between now and March, if this is a startup, we're in sort of pitch mode. We have some funding. We want to get a little bit more because we've got our eye on recruiting a couple of people to start hitting the ground running from April. So let us know if you want to sponsor us. Let us know if you want to come and work for it. Let us know if you know corporates that might be involved. A lot of the issues that we're looking at, are ones that we feel quite passionate about. The domestic abuse one during lockdown, for example, in my case, and there are others. So we're starting to line up our vision behind some really key issues. Please join in. It's fantastic. We've got 60 people on here, which I think is more than we've had, which is great. Follow us on Twitter. As Paul said, the Health Foundation are going to give that third axis to the revolution of these, which will run all the way through to March. And the last thing I would say is we're very interested in future topics. This is not we don't have a 12-month agenda, Paul and I. This is on the hoof. There seems to be a lot of interest in care homes. We're doing a ton of stuff locally. There's been quite a bit of questions in the chat, so people are going to contact me. We could run a whole session on care homes. So there's a lot of good data in acute hospitals, less so in community, less so in mental health, almost nothing about care homes, for example, and they've been such an important element during COVID that I think we should have a good look at them from a technology point of view. So that could be a topic, but there will be 58 people on here beyond Paul and I who've got a better idea. So just get in touch, let us know. The website's there, we're on Twitter. And thanks everyone for joining. We said we'd be finished for the hour, we will be. There's a couple of minutes back. There's your comfort break before the next Zoom call. Fantastic to see you all and keep in touch. Thanks again.
Thank you.